in memory of Verlinda Montoya and her lifetime of serving others.
I was a single mother taking care of my daughter, and I was looking for a career that I could have the rest of my life, no matter where I went, that it would be stable and secure. And so I chose the nursing profession. I was working for the state health department as a federal inspector for hospitals and nursing homes, so people were in compliance with regulations. And I ran into a lovely woman who was hired to start the University of Utah's home care program. And she recruited me.
Deeply spiritual and wanting to heal the whole person, Verlinda committed herself to pair her nursing training with cross-cultural healing rituals that enabled her to serve Indigenous and underserved populations.
At the same time, I was also exploring my Native American roots. And I was raised in a home where everything was done naturally. Western medicine wasn't a big part of our lives, that we looked for other ways to heal ourselves. And so when I was in the program, one of the things that was very important to me was that I knew that I needed to incorporate cultural appropriate health care. And how could I do that? Because I'm trying to incorporate my Native American roots with Western medicine. And I had the opportunity to design my own master's program to present to the committee my curriculum, which was based a lot on anthropology and cross-cultural healing rituals, and they approved it. I still graduated with a dual master's in public health and health services administration, which was also very well-rounded because it gave me the administrative side of healthcare, the things that I would need to know to run a company. And the public health degree, allowed me to be in diverse communities.
Not only did Verlinda design her own degree, soon she pioneered a whole new approach to healthcare for the communities she served in Central California.
I decided to start Heart of Humanity Health Services Incorporated. And so we launched it with our philosophy being that we wanted to provide culturally appropriate health care to the diverse community that we served.
I was so impressed when I met Verlinda. She and her entire agency, there was just a calmness and this presence of warmth and respect and a real desire to meet the needs of all of the clients that she and her team are serving.
Her team of licensed professionals, nurses, therapists, and social workers focused on culturally inclusive and spiritually competent healthcare services.
I can't think of anybody more deserving of this award than Verlinda. She came from such a humble background. She studied nursing here at the University of Utah. And she took what was in her heart and adapted that in new ways that at the time were quite novel.
I'm very proud to be able to say I'm a graduate of the University of Utah because their programs are excellent, and I feel like they prepared me extremely well to step into the world to see or work with any type of client or any age group.
In recognition of her service and leadership in the healthcare community, Verlinda received numerous awards for her work. She served on boards and committees and 2 terms as commissioner for the Marin Women's Commission for the Novato, California District. Heart of Humanity was the name she chose for her company, but it really describes Verlinda's heart. She was a visionary and innovator in her field, but mostly she cared and loved, and she will be missed.